Hi everyone, my name is Dr. Vlaimir Vavilov. I am dermatologist-oncologist at GMS hospital, and we decided to create this video for those of our patients who came from another country and who are facing the problem of skin cancer and melanoma. Let me remind you that melanoma is the deadliest skin cancer, and the incidence of this type of cancer rises every year. So here at GMS hospital we are ready to examine you and to provide you the full diagnostics of your moles, which can be suspicious. We use the certified system of Photo Finder, well known worldwide, which allows us with 20 times magnification to check all your moles and find the suspicious one. And in case of suspicious moles, we can do the biopsy to find the melanoma. What is a melanoma? Melanoma is a skin cancer. So this is a malignant tumor which arises from pigment cells in our skin, which is really aggressive. That means that it can spread to other organs and it can become fatal for the patient. However, when diagnosed early, most of the melanomas can be cured only by the surgery, and patients with early stage of melanoma has high chances of survival. The 10 years survival rate for most patients with early stage melanoma is about 98%. So that means that 98 patients out of 100 diagnosed with melanoma will survive in 10 years. So it's really essential to establish this diagnosis as early as possible. So at GMS hospital we use Photo Finder system for diagnostics of melanoma. This allows us to look deeper into the skin because it has the source of light, which helps us to get deeper into the skin and to evaluate all the structures of the mole. And in case of suspicious mole, we propose our patients to perform a biopsy, and if we find the melanoma, we do the surgery in that case. How to suspect a melanoma? So this may be a new spot on your body, a new mole which evolves, which grows with time. This might be a mole which looks very different from all other moles on your body, so-called ugly duckling. This might be also the mole which bleeds or which is red, or it can be a sore that doesn't heal with time. This can be also nodular mole, red and swollen, and sometimes this can be like a black line on your nail, which evolves with time. So in case you find any of these symptoms, do not hesitate to come to our clinic and to be evaluated by a dermatologist. What is the main risk factor for melanoma? This is first of all UV exposure, because UV with time can damage the DNA of the cells, and over time these cells can start dividing uncontrollably and they can turn into the tumor in melanoma. So it is really essential to use the sunscreens, and if you had severe sun exposure, or if you had the tanning baths in your past medical history, that means that it's better to go to dermatologist and have examination of your body, because you can have melanoma. How do we perform examination at GMS hospital? So first of all, we will discuss with you all the risk factors that you have about melanoma. Then we will do full body examination, including the private areas of your body, so we can find the most suspicious spots on your body. If you have multiple moles, we do so-called moles mapping. So we have our automatic system which can capture your body in specific positions, and we map all the moles on your body, and we do the dermoscopy of any mole that you have on your body, so we can evaluate them under the magnification. And in case we see any suspicious structures, we propose you the biopsy of this mole.